So now today we are going to do speaking and specifically focusing on info gathering. Because in a health care setting, when you are kind of supposed to diagnose the patient, so it is very important that the beginning has to be correct. Okay. So for that, we have to grammatically ask correct sentences. We have to ask appropriate sentences. We should not sound judgmental. Okay. So it's very important that the beginning of the role play goes smooth. So in order to bond with the patient, it is important. Okay. And as we are focusing on grammar as well, the correct formation of sentences, so it has to be more of WH questions, do, does, and intonation. Intonation as in tone of the healthcare professional. So it can't be rude. Are you an alcoholic? So he'll get scared. So the tone, the pitch, voice modulation, everything has to be perfect. Okay. So let's start with this. So this is, you have to just start the key, identify the key question. So if the answer is because I had a sore throat, because. So when is because used? Because as in we are giving some
Reason.
reason. We are giving some reason. So what will be the question formation for it? What? No. Then?
Why did you see the doctor?
So when you want to know the reason, why? Next Tuesday. When? Next Tuesday. When are you scheduled for knee surgery? It's the one on the corner of Swan and River Street. Where? Where means kahan? Where? So where building is the mental health? Which? That's right, Damini. Which? So we are asking which one is this building? Where means the area or location where it is. So which building is the mental health center? Dash is your specialist. If who? Everybody agrees? Whom? Whom would come? Okay. So who? For person. Who is your specialist? Dash, are you having the X-ray? If the answer is in location, where? So these are certain key structures that you should always remember. Similarly, some more examples. If the answer is yes, no, yes, please, the pain is very strong. No, thank you. Do you need more pain relief? Everybody agrees with Manisha? Do? Nisha, do you agree?
Yes, ma'am.
Do you need more pain relief? If I say, did you need more pain relief? It won't suit? Yes, past tense. Y'all are right. Then say loud. Yes, past tense it is. So, do you need more pain relief right now? Yes, I did take or took. the medicine? No, I did not take the medicine. Did. We are talking about some situation. At that time, did you take the medicine? Yes, it pains, hurts. No, it does not pain, hurt. Does? Does it pain, hurt? Okay. Now, you have to form these questions correctly. They are jumbled. They are jumbled. So you have to do the correct formation. Do remember that questions would start with, it becomes easier. Okay, I'll move aside. You all can write down these. That's fast. So the first one,
What make your headache better or worse?
okay. What makes your headache better or worse? Everybody has the same answer? Yes. Next. Where is the pain?
Where exactly is the pain?
Where exactly
The pain is.
is the pain?
Exactly the pain is.
Sorry?
Where exactly the pain is.
And the other option?
Where is the pain?
Pain exactly.
Okay. So where is the focus?
Pain.
Pain.
And where?
Location.
Yeah, where?
The focus is on location. Where exactly is the pain? So the other one is also not wrong, but here we want to show more emphasis. So where exactly is the pain, Miss Smith? Hmm? That sounds more appropriate. The other one, not wrong, but this is better. And also when we talk about intonation, so we want to focus on something. Do you want to focus on is the no, we want to focus on exactly where it is. So where exactly is the pain? A little emphasis on it. Next,
Does anything make it better or worse?
does anything make it
Better or worse?
okay? Next,
Does it go anywhere else?
does it go anywhere else? Sujan, do you agree? Okay, so yes, this becomes easier if the start, we are sure about the start, that the questions should start with WH, do, does, did. Where exactly is the pain? Okay, some more.
Do you know? Do you know what may have?
Let me. Do you
Know
know
what may have caused the rest?
everybody agrees or some other way of formation do you want to try? Damini?
No.
Agree? So yes, it's okay. Do you know what may have caused the rash? Because do you know?
Yes.
Does the patient know? And may. The patient might not be sure about it. So what may have caused the rash? Okay, now the other four,
And it is
when did it?
When did it?
Okay, Nisha. The next one, Damini, the seventh one. Be a little louder.
Why have you
Why have
you
brought
brought her the hospital today?
the hospital today? Five. When is
First.
six? So why have you brought her to the hospital today? Why have you brought her to the hospital today? Next.
Did the tablet work?
Did the tablet work? Yes. So sometimes what happens is when we do speaking one-on-one practice, so some students, what common mistakes are done? The tablets worked, so expression and tone, based on that, they are asking question. So that is not correct. So we have to form sentences in OET, that is compulsory. Okay? Did the tablets work? Do you live alone? Sometimes I also come across what about your eating habits? When the healthcare professional wants to ask about the diet pattern. So in a very casual way, the health professional would go about like, tell me something about your eating habits. So it is not grammatically incorrect, but our task, the assessment criterias are that we have to ask correct questioning. The method has to be correct. So the structure has to be correct. And that becomes too casual. Okay? Okay, now this is the scenario. So today, as we are focusing on info gathering, so we will only focus on info gathering plus one more thing, just the GIP, greeting, introduction, and purpose. We will be only doing these two things. So you all have 2 minutes, go through this. So when you see the role play card, what is the first thing that you do? GIP. So somewhere in the corner, you just write GIP. Now, based on the notes given, is greeting required? Okay. Is introduction required? Is the patient known or unknown? Unknown. So introduction is also required. And purpose? No. Sorry?
Given.
Although it is given, but it is not required. Purpose should be done only when both the people, the health professional and the patient, have some idea about the visit. Both know, but still we are just confirming the purpose so that as a health professional, we might not give some procedure, injection or some medicine to the wrong person. Just confirming. Both have an idea about the meeting. Probably he is here for a procedure, for an endoscopy. Probably the patient is here for a follow up. But just to confirm that both of y'all are on the same page. None of y'all have any wrong idea about the reason of the meeting. So purpose should be done just at that time. Okay. So here the patient is unknown from the very beginning. We are going to start. So no need to confirm the purpose. Okay, then when you see these questions, before info gathering, signposting, I would like to ask some questions. May I? And then numbering the questions, just so that we do not forget to skip any question. Okay. Manisha, start. Go ahead.
Good morning.
Good morning.
How many pictures?
Okay, that's perfectly okay. But first, also introduce yourself. Try again.
Good morning.
Sure. Okay. Others, till then, you all can frame the sentences. Sorry, be louder.
Charge nurse.
Charge nurse. It's okay, that is not important right now. Just how will you go about it? How will you start? Whether you are a charge nurse, that will be written in the role play card.
Okay.
So, right now, that is not the focus. But how will you just introduce yourself? Maybe just the name.
Anisha.
Louder. I have to
I'm
visit a
God.
doctor today. My ear is really not working.
I'm not sure, that's why I'm confirming.
But it's okay. We are here to help. Go ahead. We all are learning over here. Okay. Good morning. You were right. Then, my name is.
Anisha.
I am a
Nurse.
in
Community clinic.
in this community clinic, and then ask for the patient's name and age.
Okay. May I know your name, please?
Perfect.
And
May I know your name and age, please?
પછી patient નામ કહેશે તો પછી
Then I will tell I'm here to play the part of patient. So my name is Shivani and I am 36-year-old.
how may I address you?
I said I'm Shivani.
અમુક patient બીજું નામ કે ને short name એટલે.
No, but over here, whatever the name is given to you, you call me by that name. Okay? So you are doing very good. Please don't worry. Now,
Okay.
signposting.
Okay, Ms. Shivani. I would like to ask some question to you. Is that okay with you?
Perfect. You are perfectly right. Then why the inhibitions? Perfect. Okay, yes, please.
What brought you here today?
Okay. So I have this shoulder pain. So I thought I will get it checked.
Okay. May I know the cause of your shoulder pain?
Okay. Cause of pain, injury. So in the slide earlier, we did something. Can anybody recall? For cause.
Reason. What is the reason?
May, might.
What may be the reason?
What may have caused
What may
the
cause?
injury? Do you know what may have caused the injury? Correct? So you are doing good. One change, if you are asking what has brought you in today. So we should not do signposting before that. Signposting is to be done before gathering the information. Before that, we are asking the reason for visit. So of course we will ask that, no need to take permission for that. Okay, rest was good. Okay, now continue from here. Sujan, why no? She's already saying no.
When did you get injured?
Time of occurrence. When did you get injured? Okay. Any changes or addition of any word?
When has this injury occurred exactly? Can you please
Tell me.
explain?
Okay. Anything else?
Did you notice any specific time for occurrence?
Okay. My focus is on when. So, more or less, everybody is right. Okay. So, Jan. And our criteria are asking simple open questions. No compound, no leading questions. So, time. When did this happen? What you all said is also okay. Have you noticed when exactly did this happen? Okay. Next, duration means duration for what they want to know.
From
The shoulder pain.
Okay. Anything else?
How long have you been feeling shoulder pain?
Yes, Nisha. How long? Since when is this pain? So, how long have you
experiencing this pain?
how long have you been experiencing this pain? How long have you
Had this pain?
had this pain? How long have you had this pain? Anything else? Good enough? Jabir says this much is good enough. No need to explore more. Yeah, okay. So, duration. Previous occurrence by tricky try.
Have you had any previous injuries similar to this before?
Before the.
Okay, so
It's
close. So previous occurrence of a similar injury. So probably the answers over here are
shoulder pain, sorry.
Shoulder.
Inquire about the shoulder pain.
Yes,
I should ask
shoulder.
about it.
So I will give you all the answers so that there is a little more clarity about it. So cause of the pain. So I play football on the weekends, and recently during one of the games, I think I injured my shoulder. So cause of the pain, probably the game. Time of occurrence when I was playing. Duration. So in the patient's card, I think it says that I've had it since a few days, but I did not show the doctor. But today I have come. So since a few days. Previous occurrence of shoulder pain. So how will you ask? Sujan.
When this occurred?
Go ahead. Right? Okay, so I can help you. Is there anything over here? Okay. Go ahead. Try. Jabir, can you repeat?
Have you experienced a similar pain
Before.
before?
Repeat.
Have you experienced similar pain before?
Okay. Have you experienced a similar pain before? Have you experienced this kind of shoulder pain before? Okay. Next, ask more about the symptoms. So when you again have questions, so before the first one, you do info gathering, you do signposting, but we do not take permission at every task, just once. Now, I would like to ask some more questions and start with the question. Damini?
Have you noticed any specific factor which aggravate your pain?
Okay, perfect. Any other word for aggravate?
Anyway,
Both
Aggravate.
are opposites, na?
Is there anything that make it better or worry?
Or worse.
Hmm.
So worse can be used and better can be used for alleviating. See, there are 2 points. So we should not ask 2 questions at a time. It is a big no. Okay? The assessment criteria says one at a time. So, yes, aggravating is also okay. And is there anything that worsens the pain? Is there anything that
relieves.
relieves the pain or makes it feel better? And the last one, treatment taken, Manisha.
did you start any treatment?
Did you take
medication?
any medication?
Did you take any medication? Okay, okay, not incorrect. Did you take any medicine? Anything else?
Have you tried any remedies at home?
At home, have you?
Have you?
Have you tried any medicines to treat this? Have you tried any treatment? Okay. Some more questions. So you all have 2 minutes. Just go through these. Okay. So the first thing that we do is GIP. Sujan, greetings required. Required? What do you feel? Maybe no? Okay. Why no? Reason behind it?
Patient is concerned about.
I still have to go to the doctor. I haven't been yet. Or if you all can help me with this. Can you all give me some medicine? I can't hear.
It should be seen with otoscope.
But what I'm trying to say is be louder.
No,
I really don't need a checkup. Sujan, louder. So you are right. Greeting is not required. Now tell me the reason. Should I move?
The patient is concerned about.
Patient is concerned. Okay.
Heart issues, means already know.
And feeling burning sensation.
So these reasons are not correct
Hmm.
for not doing greeting. The patient has these conditions, but the reason for you to not do the greeting is not correct. What is the correct reason? Damini?
Recent history.
You take recent history. So you take right now recent history. Again, partially right. Any other reason?
Presented with symptom consist.
Jabir?
Burning sensation.
greeting, why greeting is not required?
That's my question.
She said no,
Hmm.
but greeting should be done to each and every patient, I think.
Okay, now after 45 minutes of this class, will we greet each other in between?
So after taking, she has, or the nurse has already taken some things, lifestyle and.
Yes,
medical
perfect.
history.
After taking.
Correct.
Okay.
So no greetings required.
The-
Okay, so whatever is written over here, not necessarily we know at the beginning of our role play. Okay, this is just for our knowledge, background knowledge. Just so that in the 3 minute time you can prepare accordingly. But there are certain sentences which will tell you how much you know at this stage, whether greeting is required or not. So it's written after taking an account of his lifestyle and medical history, you take a recent history. So this is not lifestyle and medical questions. Also, they are specifically saying that that has been taken. So we are starting from there. So no greeting, no introduction, no purpose. Okay, we straight away start from here. Clear? Now will you do signposting over here? Take permission?
No.
As such not required because you must have already taken during the medical and lifestyle history.
We can directly say, moving further, I would like to ask you
Some more questions, but no permission. Just this much. Perfect. Okay, Jabir, continue.
Moving further, I would like to ask you some questions
Mhm.
regarding the
Symptoms.
symptoms.
Mhm.
Can you please tell me the,
The
no. Can you please tell me when has this problem started exactly?
has has when do we use has?
Is in the information who has presented with symptoms.
Hmm.
So, okay, we can't ask
Has कब आएगा? When will has come? When do we use has?
time
Leaving.
past.
Leaving.
Louder.
Leaving.
Leaving. She
Past
has
Has had been
she has pain.
present.
You has pain.
No.
I has pain.
No.
Have. So probably has is used.
For present. She has been.
Okay.
For right now. She.
Also
We
for third person.
We are asking you question.
You has,
No.
I has,
You
for
have.
third person. So, but what we want to ask? Onset. When did it start? Or anything else? How will you frame it? Damini?
When we start.
When did it start? Not completely wrong, but if I want to ask it in a even better way, a little better. When did it start? Not wrong.
Since when have you been experiencing these symptoms?
Perfect. Since when? When did you first notice these symptoms? Even this is a proper way of asking. And also to sound polite, always maybe add the name. Miss Smith, when did you first notice these symptoms? Okay. So onset, always remember when. Time of occurrence. So what are we talking about? The burning sensation. So time of occurrence. For time of occurrence, time. Kab?
Exactly.
You, in general. Because the matter is not resolved.
And
How long you had this burning sensation?
How long you had? So from the onset, if I count, maybe for what's written? Since a few weeks or few days probably. But we want to ask when time of occurrence of the burning sensation and the symptoms. Damini, Nisha,
How often do you have the burning sensation?
how often? So the answer to this question is how often do you have burning sensation? I have this every day. But did you get your answer?
when did you
When?
experience?
When will come?
When?
Okay, now the question.
When did you experience burning sensation behind your breastbone?
Okay, when did you? So, did you signifies it means in the past.
Yes.
When did you
Experience.
experience this pain?
Yes.
But what do we want to ask right now? In general, कब कब होता है? When did means
Okay.
when it happened in the past.
When do you experience?
When do you experience closer, better? Time of occurrence. When do you usually have this burning sensation? Right?
Okay.
In a day, when does this happen? So, for time of occurrence, when do you experience the burning sensation? What time of the day you usually experience the burning sensation? And duration. Damini,
How long have you been occur The burning sensation.
How long have you been occur? Say again. How long? That is okay. The main thing you know. Now, so you all should relate. You all have asked that when does this happen? And when it happens,
What's the duration?
for how long does it happen? How long does the burning sensation last? We want to know the duration. For how long does it happen? For how long does the burning sensation last? Nisha, clear so far? Everybody?
Yes, ma'am.
Okay. So make sure after the class also you all kind of recall the correct questions used for all these questions. Also in week 2 there is question bank. Some common questions which are asked in OET. So go through that. Okay? All right. These are the same questions. Anybody can tell me quickly? We did this in the previous slide also. Sujan,
Does it make any word?
I can't hear. Do you want to come here?
Does it make your burning sensation?
Worse. Does it means what?
Burning.
Does it make worse? So it means what? But our question is anything. Is there anything that worsens your condition? Does anything worsen your condition? Similarly, next, Sujan, does anything
That will be in your condition.
okay, say the okay, treatment taken, have you is right,
Have you take any medicine or treatment for your symptoms?
perfect,
Burning.
perfect. But have you take is right now, taken. Have you taken anything? Whatever you said is perfect. Just taken. Okay. So now we will be doing a role play in pair. Okay. So I want you all to take a screenshot of this, everybody. And the patient's card. Hiral, Nisha, have you all taken?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. So Nisha and Hiral, I will put you all into this breakout room where first everybody, this is common for everybody, 3 minutes of preparation time. Over here, we will be not only focusing on what we did today, but the entire role play. We will be practicing with all the criterias. And 3 minutes for everybody to prepare. And then when you start doing the role play, please keep the timer of 5 minutes each. Clear?
Yeah.
And after in between the 5 minutes, try not to help each other, because the idea is that one person is able to speak fluently, continuously. Even if it is wrong, it's okay. At the end, we will discuss that. Clear? 3 minutes, start preparing. All right, 3 minutes are over. Now, we can change Damini and Manisha, Javed and Sujan. No comfort zones. One of y'all can sit. Manisha, okay. So Manisha can go. Okay, Manisha. So make sure you all do everything, GIP, signposting, empathizing, checking, understanding.
That we didn't do so.
That over here, that was not the criteria, but now we have to do.
Good morning.
My eye is red and itchy. And it's such on my eye.
Okay, I'm sorry to hear this. I would like to ask some questions to you. Is that okay?
Good morning, Mr.
Yeah.
Yazid.
Okay. So,
What starting reason?
tell me.
I have had some
long.
problem. I have cleared discharge for a couple of days. Only since I had cold last week, it feels like there is a grate in them and they are running at times, but otherwise there is no grate.
Okay.
I see. So,
Appearance man से कि वो देखा इससे कुछ changes has noticed any changes, any color discoloration changes in your
तो आप देख रहा हूँ सवाल पूछा. I would like to ask you some question on the track.
Yes.
okay.
So, let's get we come here.
Okay. Do you feel any discomfort in your body?
Yes, I feel I feel like there is an activity on my eye.
Breathing is
तो कुछ ड्यूरेशन जो आपने I don't know, but the aggregation of the knowledge is now free.
Okay, and what about scale? What do you think? It's 7, 8, or
Any
5?
changes?
In the
Perfect.
Because some
It feels like there is a grate in them.
starting
and they
must
are
be
running
that's
at
why I'm
times.
asking.
Okay. So in this picture, green check, other check.
Okay.
Discomfort in eyelids.
Okay.
In a discomfort check, eyelids no. Do you feel any discomfort in your
Eye
eyelid?
contact
Perfect.
lenses.
Okay, but no vichara.
No, I don't have any
I
problem.
don't use any contact lens. Grade already કઈ દીધું છે. તો આપણે હવે નહીં પૂછીએ.
Let me explain you about your diagnosis, which is
બીજી વાત contact lens. Don't feel what about the plain lens? Oh, what about the casual? Do you have
contact
pain? Do you
chemicals.
have pain?
No, I don't have.
No, I not really chemicals or great નહીં બધું જરૂર નથી આપણે બોલવાનું એ તો આપણે એકદમ ફ્રેન્ડલી લેંગ્વેજ હોય ને that's great. Okay, બસ ખાલી okay, I see,
Let me explain you about your diagnosis, which is conjunctivitis. Conjunctivitis is
Why
the
the patient
inflammation
wears
and
contact
infection
lens?
of the conjunctiva. And the possible cause of this diagnosis is
Contact lens
infection, which is viral
Some more
infection.
questions, some more questions. Do you wear any contact lenses?
एकदम ठीक છે
એ
એમાં વાર લગાડે છે બોલો
No, I don't wear any contact lens.
That's good. So, yeah, so now I have to explain.
તો પછી પૂછ
Explain your diagnosis.
ડાયગ્નોસિસ સમજાય એમને પછી અન્ડરસ્ટેન્ડિંગ ચેક કર
Does it sound understandable?
Yes, but contacted chemicals.
Contact lens.
ડાયગ્નોસિસ સમજાય મને પોસિબલ કોઝ સમજાવી દીધું ઓકે
It is kind of cold.
so can I use salty water to clean my eyes
Damage. And
In contact with chemicals and chemicals.
no,
હવે
I have not been handling chemicals.
હવે તારું ટાસ્ક છે appropriate treatment તો in a way you are મને એમાં છે salt માટે હા
So now
હવે
I
તું
would like to explain.
હા તો તું એને જવાબ આપ
I would like to explain.
No.
હા તો સીધું ઠીક છે અત્યારે નો પ્રોબ્લેમ પણ સ્ટ્રેટ અવે યસ નો નહીં કહેવાનું કન્ટિન્યુ
Let me suggest some other ways of treatment.
બેટર
What can be possible for this?
As I have told you that it is caused by viral infection, so you should use medication like antihistamines, which is anti-allergic medicine.
Explain your diagnosis.
You can you should
Now I will explain.
you should use warm or cold compresses on your eyes,
As for conjunctivitis, it is an infection in
which will help you to
eyes.
reduce pain and itchiness.
And
okay you all have a minute more
the possible
one more minute finish now
it caused by any viral
Okay.
infection
Does it sound doable?
your eyes.
What else could be the
cause of it
cause?
so is there any
What
need
could
for
be
any
causing
allergy
these
test
symptoms and how long
when
this is likely to last?
okay so it is viral
It
infection
will reoccur, then we will sure do any allergic test. But for now, you should
Couple of
use
days.
antihistamines medication.
Couple of days.
and it is perfect in my reason
Okay, I
I would like
strongly
to tell you.
can I concern
reassure you that it will not affect your reason permanently. Your affection right now maybe you may feel discomfort, but after treatment and taking proper
yes but then I
care of
can
your
I
eyes,
also use
it will
salty
be
water to
minimized.
bathe my eyes
I
તો
hope
તારું
this
છે ને
sounds
next
good
તો
to
શું છે
you.
ને લિંક કરવાનું salty water હું પૂછું છું that means I'm asking about some treatment so in a way you are saying that you should not be using salty water but the appropriate treatment is so
Okay, so
okay link કરવાનું
do you use
Shut down
any
like
face
this.
wash or any?
now Damini start
This way. What brings you here today?
I have noticed a clear discharge for
I have
couple days.
noticed
Couple of days.
discharge
All
from my
since
eyes
I've had
a
cold
couple
last
of days.
It feels like there is a grate in them. But the change happened.
I have cold now since one week, since a week.
Find out.
Okay, that you say there.
Okay,
So
so
but
yes,
so before you go ahead, I would like to ask some
Still now
specific. Yes.
so
You said regarding the research, so
now doctor
can you say
patient
how long does it
eyes.
So you have to give an overview. Okay? અહીંયા ઉપર લખ્યું છે. I just
clear
read and
discharge
itchy.
for a couple of days.
It's a few days. So I have
on the
checked
discharge.
I would
How
like to
does
ask you some
it
more
look
questions.
like?
May I ask?
Yes.
It will clear discharge.
So you have to
Um,
notice कि इसमें શું કરે છે.
What kind of,
એવી રીતે type કરે.
do you have any discharge from your eyes and
Understanding
what
check.
is the
તો
duration
કઈ typeના
of the
understanding
discharge?
અલગ-અલગ રીતે.
Yes, I noticed a clear discharge for a couple of days. Only since
Did you
I have
notice
cold
any
last
discomfort? Did you feel any
Can you please
discomfort in your
explain
eye?
how is the appearance of the discharge?
it
So
feels
do
like
you
there is
feel
a
greediness in your eye?
and they are running at times.
Yes, I do have this.
But
Do
I
you feel any pain?
Do you feel pain in your eye?
Have you-
Right now, I don't feel.
Have you wore contact lenses recently
So
or maybe
you
you
are
have
feeling
had contact with
this
chemicals that can harm the
the questions.
Hmm.
So I would like to ask some more questions. So do you wear a contact lens?
So as per the
I
symptoms
do
you
not
have
wear
described,
contact lenses.
my diagnosis for
Did
you
you,
is conjunctivitis.
Expose
It's the
any
condition
chemical?
that is
No, I'm
caused
not
by
been
viral
having any chemicals or cleaning fluids recently.
Can you tell
So,
me
well,
what is
Miss
causing this
your
symptoms and
symptoms
how long
may
is
indicate the
this likely
possible
to
diagnosis of
last?
conjunctivitis.
The main reason,
Do you
the main
already
reason
have
for this
regarding
can be viral
conjunctivitis?
infection and it may last for a couple of
So
days.
let me explain you, in a simple term,
Does that
conjunctivitis
answer
is
your
a
question?
infection
Does
and
that answer
inflammation
your question?
in your eye,
Yeah,
which
but
goes
it
by the
can
viral
it help
infections.
to
So
if I bath my eyes in
that
salty
was the
water.
solution. So I would
I
like to
wouldn't
hear
suggest
the reaction
you to do
about
this,
what
but
I had just
there is
explained.
an appropriate treatment that we can use for
Okay,
conjunctivitis.
I have understood.
For
that,
example,
whatever
we can
you have
use
said.
antiviral medications such as antihistamines. Or
So do you have any concern?
warm or cool
Salty,
compresses.
may I use salty water?
This might help.
Wash my hands.
Do you follow me?
No, Miss May, yes, no? No. Well, Miss Smith, I will
So can you
explain
tell me
appropriate treatment
how
for the.
reactive and allergy taste will be.
Yes, no તો નથી કહેવાનું direct. તો એને કીધું કે I use
There
salt
is,
water to wash my hands.
There might be a need for allergy test.
Mirror curl? Yeah, yes, you can, yes.
And-
Mirror curl.
It would be better if you did an allergy test because there is a likelihood or chances
You
of
want,
real
you want to
I
use.
can
Okay, you want to use salt, you want to use salt water, but
No, I
there
am
are
sure
some
that this,
appropriate treatment for the
condition doesn't
conjunctivitis, that
affect
is
your
not
vision.
advisable, that is not
This is a
advisable, but
permanent, this is a temporary condition. and
but
it
there
will
are some
be,
treatment
treated in
which
a
help
couple
in
of days.
conjunctivitis, such
You
as
won't have a problem with your
antihistamine,
vision.
it help in reducing
So how can I prevent
pain and
you have to
inflammation.
check
And
understanding
secondly,
after every
you
task.
should use the
Every
mark and
explanation that is there and ask concern also.
Okay?
Yes.
Any discomfort,
Am I
early
understanding?
discomfort, so are you with
Do
me
you
on
have any
this?
questions regarding this?
Yes. So how can I prevent
Do
others
you have any questions?
house from catching it?
So my advice for you is, try to avoid contact with people. Try
How
not to
can you
use
then
sanitary
taste
items,
especially
face washes
if
or
we are
towels or bed linen,
Yes, definitely,
with
yes,
other
Miss
people,
Mehta.
as it is a
Good,
contagious disease. Am I
That
clear?
it reoccurs, that we go for the.
Not wear contact lens.
Yes.
Then you have to eat.
Do you have any questions?
Yes, I'm concerned that will it affect my vision.
It's let me use.
Nisha, Hiral, finished?
Problem.
No, ma'am.
Not in your condition, right?
Not finished?
It is not a permanent
Not
thing.
finished, ma'am.
Time take for the.
Okay, y'all have a minute?
Proper
I
reason.
would like to.
Okay.
I hope his sound is shared. Does his sound is shared?
I like this one.
Yes. Yes, good questions. So I would like to give advice. So you don't share the fish or your personal necessary items. Do not share with the others because it is
For an energy test,
affect the other person.
So in this,
You need to
am I
make
in
a
favor of
contribution.
this test?
So will you be able to do that?
Uh,
Yes, I will. So before we end up the session, would you like to any questions?
So probably it's a no. That
Thank
it's
you.
not written. As a test is a no.
Because likelihood of this is very high.
It
So,
is high.
so I told them it is better I not fishing or she just asks about Kerala.
Exactly. In a question check, find out how helpful an allergy test would be, especially if it reoccurs. If it reoccurs, then how helpful is an allergy test? Should I go about it? So basically, I think the answer is not required at the learning. Over here. Or based on your knowledge,
Okay.
whatever you
I
feel.
told yes.
Based on your knowledge and the situation,
Hmm.
you can answer that. But if it is not your task,
Mhm.
then we don't need to go at depth.
Yeah, I told.
In depth, we don't need to go.
Generalized idea.
Yes. Okay, breakout rooms, close all rooms. Okay, y'all can turn around now. So how was your experience, everybody?
It was better.
It was better,
Yes.
Manisha?
Question was good.
Okay, now I will give you all. Nisha, Hiral,
Yes, ma'am.
how was the experience? Were you all able to finish?
No, half
Only
only.
5 minutes, you all had to keep the timer.
But
एक बार थैंक यू सेकंड टाइम
we change role, ma'am.
Okay, of course you had to do, but you all had to put a timer 5 minutes for one person. Okay, otherwise, if you all do not keep a timer, then the other person will not get an opportunity to speak. And all the help and corrections can be done later on. You all can sit here after the class and help each other. And also, I'm here, so you all can ask me as well. Okay, so how should you go about it? Okay, so what are the things that are important? Most important, you decide whether the patient is known or unknown. So in this case,
No.
your patient, so known patient. Greeting, yes. Purpose, not required because you are asking the reason for visit. So good morning, Miss Smith. If you ask, how are you? Just to show the relation bonding with the patient, if you ask, how are you? He might give you the reason straight away.
Yeah.
So do not ask the reason for visit there. Okay?
This is what exactly happened.
That's why I'm giving the feedback. So either do not ask that. Good morning, Miss Smith. So please tell me, how can I help you today?
and then he'll say the reason. Or if he says the reason for how are you, the reply, then straight away answer the questions.
Okay.
Okay? You have to listen actively. Okay, and then you ask these questions. Then some more questions over here, you do signposting. I would like to, in order to understand your condition better, I would like to ask some questions. Is that okay? So then, asking one question at a time, I would like to ask some more questions. Do you wear contact lens? So here, the info gathering ends. So you should be doing summarization. All right, Miss Smith, I have collected all the information and now I would like to check if I have gathered accurate information. So you said you have so and so problems. Am I right? We are discussing the structure of the role play, how it should be. Okay? When you summarize, it should be in short. You should not be saying each and every point that the patient says. You have to summarize it in one sentence. Again, signposting. Now, I would like to explain you my diagnosis. You have to say what your task is and then explain. Clear, everybody? Now, I would like to share my diagnosis with you. I would like to explain about my findings. So, what you have is called conjunctivitis. At this stage, prior knowledge. So, have you heard, do you have any idea about this condition?
Yeah.
How common it might be? Still, we are supposed to do this. Prior knowledge. Damini, did you do?
Yes.
Okay. And then go ahead with the explanation. Now, every time you explain something, you have to check if the patient has understood or not. There are various ways of checking understanding. You should be showing the variety of ways, various ways. Okay, you should not be using just one way. How does it sound? You have to use different ways. So, for diagnosis, you can say, I would like to hear your reaction on this. I would like to hear your thoughts on this. If you have suggested something, treatment, some diet, lifestyle modifications, how does this sound?
Is it feasible?
Is it feasible? Does it sound doable? Because you want to know if he will be able to do or not. Okay? So, various ways of checking understanding, plus you have to do it after every explanation. Do not worry, you all are still just, you all have begun. So, in a class or two, you will be able to do all these things, okay? Provided you all remember to do this. Okay, after checking understanding, you all have to ask concern. Compulsory. After checking if the patient has understood or not, Nisha, Damini, you all did this. New students, make sure you all do this. Okay? After each task you explain, check understanding, ask concern. Only then will you get a structure for your explanation. Mostly, majority of the time, these are the answers of the patient's questions. So if you don't ask the concern, it will be a one-sided role play.
Yeah.
You are not giving proper attention to the patient, so doesn't help us. Right? Then over here, if you ask the patient, do you have any concern? He'll say, can I use salt water to clean my eyes or wash my eyes? So you should validate. When the patient says something, validate. So I understand that you want to use salt water, but that is not advisable. So straight away, we should not be saying, no, you can't use. Yes, you can use. You have to validate the concern. I see you want to try this salt water. But Miss Smith, it is not advisable. Rather, now I would explain you the appropriate treatment for it. So what I'm going to explain, you have to say that. Now I will explain you the treatment. Just so that she is aware and she knows what to expect out of your explanation. And then you explain that, then again check understanding, then ask concern, and then if the patient says something, validate, and then move on to the next task.
5 minutes are really less.
Sorry?
5 minutes.
No, 5 minutes are not less. I'm sure you will be able to do that. Yeah, you have to do this, and plus, it is not a compulsion to finish this. Your scores are not affected if you do not reach the last point, but it is affected if you do not do the criteria, if you do not follow the criteria. Okay, so what is your takeaway?
Signposting, understanding, concern, and validation.
Perfect. One more should be your takeaway. Sujan, everybody, for everybody. Manisha? Apart from what he said, one more thing that you all should remember.
Wrap up.
Okay, that is in signposting. Wrap up.
Summarization.
Okay, this is also important. Prior knowledge. So just remember the basic structure, and I'm sure you all will be able to do it properly. Okay. Nisha, Hiran, clear? Any questions, anybody? So even I'm going to do a signposting now. So as we come to the end of this session, is there anything else you would like to ask me? Bon? Yes, Kibi?
No.
No. So I'm just saying that the class has come to an end today. So now if you all have any questions, please ask me.
You did it so efficiently, we thought it saved us.
Oh, thank you. You all thought that I'm playing the part over here. Okay. Okay, so that's all for today. Keep practicing, and if you all have any doubts, please feel free to ask over here.
Okay.
Thank you, ma'am.
Welcome.
Thank you.
Bye. Have a nice day.